Terry, you're on mute. Can't hear you.
My apologies. Good afternoon, everybody. Thank you again for joining us, and I appreciate you being here. And I'm hoping that this talk will answer some of your questions. That's our goal, to answer the questions what, why, and how. So, when we talk about cervical cancer, one of the first thoughts that comes to mind is fear. And I believe that fear is because of lack of knowledge. So let's talk about what cervical cancer actually is. Well, first of all, cervical cancer starts in the cells that line the cervix. And the cervix is the lower part of the uterus, or what we would call the womb. And it connects the body of the uterus, which is the upper part, where the fetus would grow, to the vagina itself, which is the birth canal. And cancers start when these cells begin to grow out of control. And it's not a particular type of cell, but a combination of cells that have this overgrowth that create the problem. So as you can see from the diagram here, I'm just kind of giving you a visual of where the problem occurs. Now, statistics for cervical cancer are a bit scary, but knowledge is power. And if we know the incidence of cervical cancer, that helps us in motivating us to do the right things to prevent cervical cancer. The American Cancer Society estimates that cervical cancer in the United States for 2024 had a big impact. There are about 13 million people or women with new cases of invasive cervical cancer that were diagnosed. About 4,000 women will die from cervical cancer. Cervical precancers are diagnosed for more often than the invasive cancer itself because we're catching them early.
He's tied in. I guess
Cerv-
it's for y'all.
I'm sorry? Oh, I heard somebody talking. Okay, cervical cancer is most frequently diagnosed in women between the ages of about 35 to 44. We're still in those childbearing years, with the average age being about 50. It's rarely developed in women younger than the age of 20. Many older women don't realize that they're still at risk for developing cervical cancer, and so they're not getting their screenings. More than 20% of the cervical cancers that are found in women over the age of 65. These cancers occur rarely, but the biggest problem is the lack of testing. So for these cancers, getting regular testing to be screened for cervical cancer is very important, even at the age of 65. When we talk about the incidence and the mortality associated with cervical cancer, let's look at the incidence. Well, first of all, the incident rates have been decreasing, which is great. We've decreased from more than half of what it was in the mid 1970s to the mid 2000s, largely because people are getting screened. But these numbers have stabilized over the past decade. Women ages 30 to 34 rates have increased by 1.7% from the year 2012 to the year 2014, which is an indication that we're still having a rise in the incidence of cervical cancer. It was once considered the most common cause of cancer in women. The cervical cancer death rate has dropped by more than half since the mid 1970s, but prevention and screening has kind of stabilized or tapered off. And the death rate in Black women and Native American women is about 65% higher than that of white women. Again, it kind of reflects the percentage by race or ethnicity of the individuals being screened. When we look at the anatomy of the cervix, it helps us to better understand what's going on and where. First of all, the cervix is made of two parts, and it covers different types of cells, meaning that the incidence of cervical cancer is not necessarily an overgrowth of one type of cell, but of two different types of cells. The endocervix, which is the opening of the cervix that leads into the uterus, is covered with glandular cells. The exocervix, or the ectocervix as it's normally called, is the outer part of the cervix that can be seen by the doctor when they're doing their exam, a speculum exam. It is covered in squamous cells. The place where these two cells meet together is called the transformation zone. That is between the actual endocervix and exocervix, right at the tip of the cervix and the base of the vagina. Okay. The exact location of the transformation zone changes as we get older. And if you give birth, of course, you have that linear expansion of the uterus and the not the fallopian tubes, the cervix and vagina. And so as these cells meet, that is when you have the transformation or overgrowth of these cells. So most cervical cancers begin in the cell transformation zone. So when we talk about the signs and symptoms, what's going on? How do I know? So some of the signs and symptoms include an unusual vaginal bleeding, such as bleeding after sex, between periods, or after menopause. Having vaginal discharge that is watery, bloody, or has a strong odor. Pain during sex or in the pelvic area. Pain in the lower back or between the hip bones. Increased urination or urinating more frequently. Swelling of the legs and blood in the urine. Now, these symptoms can be associated with other things, but it is important that if it's occurring, that we don't ignore them and we don't mentally rule out cervical cancer. Cervical cancer can often have no symptoms at all in the early stages. And not everybody that has cervical cancer will experience any of these symptoms. So it is important that we maintain an awareness. If you're having any of these symptoms that we just discussed, it's very important that you are screened, that you talk with your physician, preferably your gynecologist. So cervical cancer detection, we got to know what's going on to be able to fix the problem. The best way to find cervical cancer is, of course, screening, and screening early. The tests for cervical cancer screening are the HPV test and the Pap test. They can be done alone or they can be done together, and that's called a co-test. And regular screening has shown to prevent cancers and to detect precancerous cells. Most important thing to remember is to get screened regularly, no matter which of the tests you choose, whether you're having the Pap or the HPV or both. Early detection greatly improves our chances of successfully treating precancers and cancers. Being aware of any of these signs or symptoms of cervical cancer can also help to avoid delays in diagnosis and treatment. So, the American Cancer Society has developed guidelines for the prevention and detection, early detection of cervical cancer. These recommendations, as I said, come from the American Cancer Society. And the first one is one that can also be used for precancer, which, helps us to prevent the actual occurrence of cancer itself. These guidelines don't apply to people that have already been diagnosed with cervical cancer or pre-cervical cancer. The guidelines actually say that testing should be done or begin at age 25. Those 25 to 65 should have a primary HPV test every 5 years. If the primary HPV test is not available, screening may be done with either a co-test that combines the HPV test and the I never can say this word right. So it's the papillonicoli test, pap smear, every 5 years, or a pap test alone every 3 years. Now, the guidelines also say that women over the age of 65 who've had regular screenings in the past 10 years with normal results and no history of cervical cancer, C1N2, or more serious diagnosis in the past 5 years, you shouldn't need to have a cervical cancer screening any longer. Once stopped, you shouldn't have to restart it. People who have had a total hysterectomy should stop the screenings, such as a pap test and an HPV test, unless the hysterectomy was done as a treatment for the actual cervical cancer itself or serious precancer. People who have had a hysterectomy without the removal of the cervix, called a supracervical hysterectomy, should still continue to have their screenings done according to the guidelines above. Those individuals who have been vaccinated against HPV should still follow the guidelines as well. So when we look at the importance of this screening, again, as I had said, it was one of the most common causes of death in American women. With screening, the detection and treatment can occur much quicker, therefore dropping the rate of the incidence of cervical cancer itself. The pap smear is one of the reasons that this rate dropped, but death rates have not changed much over the past 10 years, which means people are not getting the screening. These screenings offer the best chance for cervical cancer detection and treatment. And these screenings can also actually prevent most cervical cancers by finding these abnormal cervical cell changes early so that they can be treated before they have the chance to turn into a cancer. When we look at some of the impact of cervical cancer, prevention and screening, one of the biggest issues we find is finance. Financial issues can play an important role in whether or not a woman, is screened. Women with low income and those without health insurance are less likely to be screened. Therefore, they are at higher risk for developing cervical cancers. Many states ensure that private insurance companies such as Medicaid, public employee health plans, are required to cover these screenings so that these individuals have the opportunity for early detection. There's also programs available to help, financially assist women with lower income and those without insurance. What's important for you to know is that insurance coverage may or may not conform to the American Cancer Society screening guidelines, meaning they may opt to approve or pay for screening at different intervals rather than the guidelines that have been set by the American Cancer Society. So, how is cervical cancer treated? Common types of treatment for cervical cancer include surgery, which usually means a hysterectomy, radiation therapy, chemotherapy, targeted drug therapy, and immunotherapy for cancer, for cervical cancer. Depending on the type of cancer and the stage of your cancer, you may need more than one of these types of treatments. There may even be a combination of treatments. For the earliest stages of the cancer, surgery and or radiation with chemotherapy may be used. For later stages, radiation combined with chemotherapy is the main treatment. And for some, chemotherapy by itself is often used as a treatment for advanced cervical cancers. So what causes cervical cancers? Well, we talked about these cells and this overgrowth. There are some genes that control cell growth, division, and death. Genes that help cells grow, divide, and stay alive are known as oncogenes. Genes that help these cells grow under control or make these cells die at a regular pace are called tumor suppressor genes. Cancers can be caused by changes or mutation in the DNA that turn on the oncogenes or turn off the suppressor genes, allowing the overgrowth of these cells. The human papillovirus, HPV, have two proteins known as E6 and E7, which turn off some of these tumor suppressor genes, such as the P53 and RB. This then allows the cell lining of the cervix to grow too much and to develop changes in addition to creating other genes, which in some cases can lead to these cancers. So there is both a genetic and an environmental component to cervical cancer itself. So when we look at the risk factors, there are many risk factors for developing cervical cancer. And we have some that are modified and non-modified. What we mean by that is the modifiable risk are the things that we have the ability to change to prevent cancers. The non-modifiable risks are those risks that we have no ability to change ourselves. A risk factor is anything that increases your chance of developing a disease such as cancer. Different cancers have different risk factors. Several of the risk factors that can increase your chance for developing cervical cancer are those that we talked about that are modifiable. When you think about the risk factors, it helps us to focus on those that you have the ability to change. People without any of these risk factors rarely develop cervical cancer. Although the risk factors can increase the odds of you developing cervical cancer, many of these risks don't develop the disease itself. So when we look at the modifiable risk, those are the things that we can change. A big risk in developing cancers of many types is smoking. Another modifiable risk is the contraction of the HPV virus, contracting the virus itself. Other risk factors that we have no control over whatsoever is our age. As we age, as we have children, that creates a change in the reproductive system itself, and it causes the changes in the cell mixture to be lower, which impacts the cervix itself. And our family history, because there is a genetic component. If there are other members, other females in the family that have developed cervical cancer, it is very possible that you carry that same gene. So again, just kind of summarizing those risk factors. I put this slide up because to me it speaks volumes. And so just looking at the agony on this poor woman's face helps us to kind of think about what we don't want to go through. So the risk factors that increase your chances of developing cervical cancer, again, are 1, the HPV virus or infection. If you have immunodeficiencies or immune system deficiencies, if you develop herpes infections, smoking or tobacco consumption, younger age, low socioeconomic factors, the use of oral contraceptives, and the use of a medication called dithiazolidinedostol. Guys, I apologize for butchering that. It's something I have a very difficult time pronouncing. But when we talk about these risk factors that we have the ability to change, we look at the HPV virus infection, the most important risk factor for cervical cancer, because HPV is a group of more than 150 related viruses. Some of them cause a growth in the papillomas, which are more commonly known as warts. HPV can affect the cells on the surface of the skin and those lining the genitalia, the anus, the mouth, and the throat, but not the blood or internal organs such as the heart or the lungs. HPV can spread from one person to another during skin-to-skin contact. A lot of people assume that it has to be sexual contact. One way HPV is spread is through sexual activity, including vaginal, anal, and even oral sex. Different types of HPV cause warts on different parts of the body. Some cause common warts on the hands and the feet. Others can lead to warts on the lips or the tongue. Other types of HPV are high-risk types because they are strongly linked to cancers, including cancers of the cervix, vulva, and vagina in women, penile cancers in men, and cancers of the anus, mouth, and throat in both men and women. Infection with HPV is common, and most people clear the infection by themselves. Sometimes there are infections that we don't clear, that don't go away, and they become chronic. These chronic infections, especially when it occurs by certain high-risk HPV viruses, can eventually cause this overgrowth in cells, which then again can lead to cervical cancer. Although there's currently no cure for HPV infection, there are ways to treat the warts and the abnormal cell growth through HEV that HPV causes. Vaccinations are available to help prevent the infections by certain types of HPV and some of the cancers linked to those types. So HPV vaccination is very important in the prevention of cervical cancer, and it should be given early in life. Sexual history plays a role in your risk. Several factors relating to your sexual history can include the risk of cervical cancer. The risk is most likely affected by increasing the chances of exposure to HPV. Becoming sexually active at a young age, especially younger than age 18. Having multiple or many sexual partners, again, you're at a higher risk for developing the HPV. Having one partner who is considered high risk, someone with HPV infection already, or who has many sexual partners other than yourself. When someone smokes, they and those around them are exposed to many of the cancer-causing chemicals that can affect the organs and other than the lungs. These substances, usually acrolein is one of them, are absorbed through the lungs and then carried through the bloodstream throughout the body. Women who smoke are twice as likely to develop cervical cancers. Tobacco byproducts have been found in the cervical mucus of women who smoke. That's terrible. Researchers have now believed that these substances in cigarettes can damage the DNA of the cervix and then contribute to the development of this cervical cancer, the stimulation of these abnormal cells to grow. Smoking also makes the immune system less effective in fighting the HPV virus. So smoking is a risk factor, one that we have the ability to change, but not only the ability to change it. When we smoke, we increase our risk significantly for the development of HPV. Having a weakened immune system. That refers to people with the human immunodeficiency virus, HIV, and the virus that causes AIDS. This can weaken the immune system and put you at risk for HPV infections, as well as other infections. Other groups of women at risk for cervical cancer are those taking drugs to suppress their immune system response, such as people who have an autoimmune deficiency, people who have received transplants. What happens is the systems that the body normally uses to attack foreign viruses, germs, is weakened, and they don't have the ability to fight off the virus. And with that, the virus has the opportunity to cause cellular change, which allows for the growth and overgrowth of those cells. Chlamydia. Chlamydia is relatively commonly found as a bacteria that infect the reproductive system. It is spread, of course, through sexual contact. Women who are infected with chlamydia have no symptoms, and they may not show that they're infected at all unless they're tested. Chlamydia infections can cause pelvic inflammation, leading to infertility. Long-term use of oral contraceptives or birth control. Evidence has been shown that oral contraceptives for a long time increase the risk of cancer, cervical cancer. Research suggests that the risk of cervical cancer goes up the longer a woman is on oral contraceptives, but the risk goes back down after they stop taking them. A woman and her doctor should always discuss whether the benefits of using an oral contraceptive outweighs the potential of developing the disease. Women who've had a 3 or more full-term pregnancies have an increased risk for developing cervical cancer as well. It's probably due to the increased exposure to HPV infection with sexual activity. Also, studies have pointed to the hormonal changes during pregnancy as a possibility of making a woman more susceptible to the HPV virus or the growth of cancer cells. Another thought is that pregnant women might have a weaker immune system, allowing for the HPV virus to grow. I know these are a lot of risk factors, guys, so I'm still going through them. One of the other risk factors that you can actually change, believe it or not, is young age at first full-term pregnancy. Women who were younger than 20 years of age when they had their first full-term pregnancy are more likely to get cervical cancer later in life than women who waited for their first pregnancy full-term after the age of 25. Your economic status. Many low-income women don't have the ease of access to having the health care to have the screenings done. And so they may not get screened or treated for cervical precancers, which then are allowed to develop into cancers. Believe it or not, a diet low in fruits and vegetables. Women whose diets don't include enough fruits and vegetables may have an increased risk for cervical cancer. You're not taking in enough of the nutrients that help to build the immune system, which then makes you vulnerable. There are a lot of risk factors, guys. Now, this one is the diethylacetobacetol, DES, which is a hormonal drug that used to be given to women back in the 1930s through 1971 to help to prevent miscarriages. This drug, which mothers took when they were pregnant, developed clear cell adenocarcinoma of the vagina and the cervix more often than women would normally get. So the risk appears to be greatest in women or mothers who took this medication. The risk appeared to be greater in women whose mothers took the drug during their first 16 weeks of pregnancy. The average age of women diagnosed with DES-related clear cell adenocarcinoma is 19 years. So we're seeing this from individuals who began taking the medications early in life to prevent pregnancy, and then during their full-term pregnancies, there were these alterations in their cellular makeup. The other risk factor is having a family history. We kind of talked about that a little bit. Cellular cancer may run in some families. If your mother or sister had cervical cancer, your chances of developing the disease are higher than that of someone whose family has no history. Factors that lower your risk. What can we do to lower the risk? Well, we talked about the fact that oral contraceptives increase your risk. So what is an alternative? Intrauterine devices, IUDs. Some research has shown that women who have ever used an IUD had a lower risk of cervical cancer. The effect of risk was seen even in women who had an IUD for less than a year. And the protective effect remained after the IUD was removed. IUDs do have some risk. A woman interested in the use of an IUD should always have a discussion with her physician. Also, a woman with multiple sexual partners should use condoms to lower your risk of sexually transmitted diseases, no matter what other forms of contraception she may use. When we talk about the staging, the stages of cervical cancer, individuals who are diagnosed always try to figure out how it was spread, also how far it's gone. This is called staging. The staging of a cancer describes the extent of the cancer in the body. It helps to determine how serious the cancer is and how best to treat it. So staging is one of the most important factors that is used to decide how to treat a cancer and how successful treatment might be, your prognosis. To determine the cancer staging after a cervical cancer diagnosis, a doctor is going to try and answer these questions. How far has the cancer grown in the cervix? Has the cancer reached nearby other structures? Has the cancer spread to nearby lymph nodes or to distant organs? The International Federation of Gynecologic and Obstetrics staging system is used to stage cervical cancer in females and in the reproductive organs to include the cervix. So for cervical cancer, the clinical stage is used and is based on the results of the doctor's physical exam. That includes biopsies, imaging, and other tests that can be done in some cases, such as a cystoscopy and a procystoscopy. These tests are actual visualizing these cells and their level of growth. Cervical cancer staging ranges from stage 1 through stage 4. As a rule, the lower the number, the less cancer has spread. The higher the number, such as stage 4, means more than, that means that it is a more advanced cancer. Within a stage, as an early letter, which helps to lower the staging itself. So these cancers with similar stages tend to have a similar outlook and are often treated in the same manner. Detailed staging information can be found at the following website. I know it sounds a bit confusing, and so we put this website on to help women who may have been diagnosed to better understand where they are in regards to the staging. And the website is www.cancer.org/cancer/types, and then you would put in the actual type of cancer that you're trying to determine the staging on, whether that be cervical cancer, prostate cancer, liver cancer, stomach cancer, whatever. But that website will be sent to you when you receive the actual presentation materials. And it is a very good site in helping you to understand these different stages of different types of cancers. So, questions about cervical cancer. It's important that you have a frank, open discussion with your cancer care team. They want to be able to provide you these answers, but sometimes it takes you to ask the right questions. And that helps you in making the life decisions on how and what treatments that you should receive. So these are some of the questions you consider. When you've been told you have cervical cancer, what type of cervical cancer do I have? Have my cancer cells spread outside of the cervix? Can the stage of my cancer be determined, and what does that mean? Will I need other tests before we can decide on a treatment? Do I need to see another doctor or healthcare professional? If I'm concerned about the cost and insurance coverage for my diagnosis and treatment, who can help me? Those are some of the questions. There are even more. What are my treatment choices? What treatments do you, as my physician, recommend, and why? How much experience do you have treating this type of cancer? Should I get a second opinion? How do I go about getting that second opinion? Can you recommend someone? What would be the goal of the treatment? How quickly do we need to get started on these treatments, making that decision? What should I do to be ready for treatment? How long will the treatment last? What is it? What will it be like? Where will it take place? How long will this be done? All of these are pertinent questions. When you're deciding on a treatment plan, what are the risks and side effects for this particular treatment? What treatment do you suggest? Are there things I can do to reduce the side effects? How might my treatment affect my daily activities? Will the treatment put me into menopause early? Will I need hormone replacement therapy after? What are the chances of my cancer will reoccur or come back? What will we do if the treatment doesn't work? Will I be able to have children after my treatment? What are my treatment options in regards for children in the future? All of those questions are the things that should be addressed if and when you are diagnosed. So what's new in cancer therapy, cancer research? Many ways to treat and prevent cancer of the cervix are being researched now as we speak. And there's promising news in the development of these treatments to include immunotherapy, which boosts the immune system, targeted therapy to address the particular cells themselves, radiation therapy to radiate or eliminate those cells, chemotherapy, and the HPV vaccines. They're all being researched to help to provide a prevention and a cure for cervical cancer. The most important thing, again, that we have to remember is to get tested early and regularly. So I know I've given you a whole lot of information in a very short time, and I'm sure that you have questions. So at this point, I'm going to open the floor up for questions. So if you would unmute yourself, I will take your questions now.
I have a question.
Yes, ma'am.
My question is there, is the pap smear and those tests the only way to detect, have early detection for cervical cancer? The reason I'm asking is, I've had one pap smear, one coloscopy or something like that. I can't say the word. And another pap smear, all within like a 7-month period, and they're all abnormal, but no HPV.
Okay, so you can actually develop cervical cancer without having HPV. The HPV is about 150 different viruses, but the cancer itself is the irregular growth, the irregular growth of these combination genes and cells at the point that they meet at the cervix. And so having the abnormal cells generally is an indication of pre-cancer. What that means is there is a increased growth in those cells, but not to the point that it has gone to a cancer. Am I answering your question?
Yes, ma'am, that makes a lot of sense. My doctor wasn't very clear on that. He wasn't sure this is where I'm kind of confused because he was mentioning that from now on I get pap smears every 3 months until it shows what it is.
Right. Because you can have abnormal cells that don't necessarily convert to a cancer. But
Okay.
then those same abnormal cells could make that transition. And so the reason you're being tested so frequently is to ensure that those abnormal cells that are occurring have not converted.
Okay, so that is the process of diagnosis then, just
Yes,
every three
ma'am.
to 4 months. Okay,
Yes,
okay,
ma'am.
that answers a lot. Thank you so much. I appreciate this.
You're very welcome. Does anyone else have a question? Heather, are you receiving any questions in the chat?
No, ma'am, I'm not.
I know this is a lot to take in on a very serious subject. And so I encourage you, first of all, for women over the age of 20 to have regular screening based on the guidelines that we discussed. And you'll get those guidelines in writing and have them regularly. There are a lot of people that say, oh, I had my pap smear and I don't want to go back. I hate doing that. Well, sometimes not knowing is the worst thing you can do, because with early detection, the cancer can be treated or it may be caught early before it develops into a cancer.
I have a question.
Yes, ma'am.
If not my immediate family, like sisters or anything, have had it, but I have two cousins that have had cervical cancer, breast cancer and stuff. Is that included like family having it?
Yes. Okay. You have
Okay.
to remember this. You, your risk are lower, but you are one half of your mother's genes and one half of your father's genes, which means you are 1/4 of your grandmother and grandfather's genes on both sides. Your cousins are also 1/4 of your grandmother and grandfather's genes on both sides. So
Okay.
there is a possibility that that gene that triggers the abnormal growth could be passed down. And then there's the possibility, based on genetics, that you don't have the gene. Does that make sense to you?
Oh, yes, ma'am. Yes, ma'am. I
Yeah.
just wanted to
So,
ask, 'cause I know that I had breast cancer and they told me it was mainly on my mother's side.
yes.
And these cousins are on my father, one's on my father and one's on my mother. So I was just asking.
Yeah. And unfortunately, the more family members on opposite sides of the family that have the diagnoses of breast or cervical cancer, the more likely you are to carry the gene, because it's coming from two different sides, two different genetic pools.
Okay. Okay, then I'll keep on doing, I do my pap
Yes,
smear
ma'am.
like
Please.
every 2 years.
Yes, not only am I an educator, at the age of 23, I had cervical cancer.
Okay.
So, yeah, this is a subject that's near to home for me. Anyone else have a question? If not, I'm going to turn this back over to Heather. I thank you for your time and your attention, and I look forward to you attending other topics that we discuss. I hope you have a great day and a great weekend.
To answer the last question is yes. The recording will be sent to everyone that pre-registered. So once they're available, I will send that recording out along with a survey. So if that is, you're welcome.
Okay. Anything else?
No, ma'am, that is it.
All right. Well, everybody have a great day. Thank you so much.
Thank you. You guys
Thank
all
you.
have a good one.
Thank you.